Hello and welcome to On Second Street. It's no surprise that healthcare continues to be a top concern among Canadians here in Canada. And at secondstreet.org, the think tank that I work at during the day, we enjoy really digging into the issue of healthcare and talking about how we can find solutions to help improve the system. And recently we put 4 questions to the Canadian public through a poll that was conducted by Leger. So we're going to dig into Canadians' thoughts on health reform and how they're using the system. And we've got 2 excellent guests lined up to talk about this today. First is my colleague, the Don Lucyk from Regina. He works at Second Street as our communications director. He's going to walk through some of the numbers, and Dr. Shawn Whatley from Ontario is going to provide his insight into sort of what the findings look like. And Dr. Shawn Whatley is not only a family doctor with a practice in Newmarket, he's also a past president with the Ontario Medical Association. He's written multiple books on health reform. So we've got a pretty talented panel here today to talk about this issue. Dom, I want to start off by asking you about one of the issues that I think was quite concerning, and that was people avoiding using the healthcare system altogether because they don't feel that they're going to get care in a quality and timely manner. Could you just unpack that question for us?
Yeah, for sure, Colin. So I think we expected this number to be high when we asked the question in the Leger poll, but basically across the country, it is about 47% of Canadians say that they have avoided going to the hospital or to see a doctor because they don't think that they'll get care in time. This does vary across the country. It's the highest by far in the Atlantic provinces, where it's at 65%. But even in Alberta, where it's the lowest number, it's at 41%. So this is a significant chunk of the population who are simply saying, well, I don't have the time, or I just don't think that I'll be able to get the care. So I'm going to stay home. So, I mean, first of all, this is, just think about how much worse this can make the healthcare crisis as it is. If someone has a strange pain or something like that, and they're not 100% sure what it is,
Mm.
maybe they would go to the doctor and find out if it's something serious that's in need of urgent treatment. But if they're not going, then that issue might remain hidden, and it might get worse and worse and worse. So really, this is just one of the worst indicators I think I've seen, frankly, when it comes to our polling on healthcare.
Yeah, and I was surprised by this number too. It seems very high. And I think back to COVID when we heard this was going on, where people were avoiding the healthcare system because they didn't want to get exposed to COVID or because they knew it was busy, whatever. But we're 2 years out of COVID. To see the number at that rate was surprising. Dr. Watley, I want to ask you. You're working on the front lines of healthcare. Is this number surprising to you? Are you hearing this from patients? What are your thoughts on this?
Yeah, no, I'm glad you have this data, and I would say absolutely, it's probably, one of the top reasons people give when they say why didn't you come in sooner? Why didn't you go? Oh, the merge is so blocked. I don't want to go there. I don't want to be a bother is the probably number two on the list. And number three would be I don't want to be a burden on my family. Having said that, though, just to add a wee bit of balance, we have to be cautious because most patients don't like to go to the hospital. They don't want to go to the emerge. They don't
Mm.
want to go see their family doctor. Most people don't like being poked and prodded when they're in pain. They don't want needles. They don't want IVs. So we have to be try to think about how we can parse this number out. And one way we could do it is to look at the difference in volumes when you actually do drop wait times. So we did that in our merge. We dropped them down from 4 to 6 hours to see a physician down to around, under half an hour, and our volumes increased by 25%. So we can be certain that there are 25% of the population out there that simply are going somewhere else or delaying care or avoiding care. So it's another statistic to throw out there, but the one that you've come up with is important. And I think we need to talk more about it for sure.
We've only got a few seconds before the break, but have you seen data on this in the past? Like I said, I'm surprised, but have you seen any numbers to suggest it's higher or lower than what we've seen before?
I don't have anything that jumps to mind to compare with the specific question that you've asked on this survey.
Okay. All right. Well, listen, when we come back, we're going to dig into a few of the other questions that we posed. We'll be back with more in just a moment.